Welcome to the Fed to Fed Podcast's MHS Digital Front Door series. In this special collaboration with the Leidos Partnership for Defense Health, we explore what it takes to drive digital transformation in government healthcare. Through candid interviews and virtual panel discussions, we're driving thought leadership on tech innovation and government healthcare. We are so happy to have you tuning in.
Well, welcome to today's conversation. We are going to have a great time. My name is Dr. Kosiak. I'm the Chief Medical Officer for Leidos. I'm an emergency medicine physician and have been involved with the Leidos Partnership for Defense Health for almost the last decade. Our goal today is to talk to some of the senior leaders who have been involved in the program, talking about where we are today and where we're going in the future. We have a distinguished guest list today, and I'm just going to do a brief introduction of our guests, and then I'm going to turn it over to them to see if they'd like to add any color. So today, we are going to start in no particular order with Colonel Christina Sheets. She is serving as the program manager for the DoD Healthcare Management System Modernization Program Management Office. That's a lot to say. In this role, she provides acquisition, leadership, and optimization management for the program commonly called MHS GENESIS. Colonel Sheets, thanks for joining us today. Next, we have Miss Naomi Escoffery. She's the acting director for the Deputy Assistant Director, Acquisition and Sustainment, better known as the Chief Accelerator Officer, I think is how most people know her today, and Innovation Program Manager at DHA. Her portfolio includes a lot of things, including my military health, which we'll try to touch on a bit here. So Naomi, welcome to the program. Next, we have Dr. Ron Moody, the Chief Medical Officer for Accenture Federal Services. Ron had a distinguished career in the military prior to joining the Accenture team. He now works across the federal agencies with data and outcomes and all things virtual health. So Ron, welcome. And last but not least, we have Andry. She's the Chief Clinical Leader, Senior Director at Oracle Health. She has been with the program Leidos Partnership for Defense Health since the early days and the beginnings, and knows where all the fun activity has been around the globe when it comes to the electronic health record go live for the DHA. So that's our panel. I'm going to turn it over to Colonel Sheets. And just if there's anything you wanted to add to your bio or your background, and then we'll get right into teasing you with some questions.
Oh, thank you, Dr. Kosiak. I appreciate the kind introduction. I've been on this program since 2018, so just after IOC, but before Wave Travis. And I came on the program as the dentist. So many of you know I'm a dentist by trade, a prosthodontist, and started off there and then came up through baseline sustainment and then to be the program manager. So I've really lived this program over the past several years and just couldn't be any more proud of the team we've assembled. And I do mean team broadly across DHA, the partnership, and the program office to really do some amazing, incredible things. So thank you and look forward to the conversation.
It's going to be fun. Naomi, how about you? I know I introduced you as the Chief Accelerator or Innovation Officer. That's what a lot of people around the industry know you as. If you wanted to spend a minute talking about what it is that you're doing today for DHA.
Absolutely, and thank you for having me. I greatly appreciate the opportunity. And actually, a little quick, I'm not the deputy anymore or acting deputy or whatever that was beforehand. I am now fully the Chief Accelerator Officer, so I will have a pink Power Ranger uniform to follow.
Let's go.
We're embarking on a true transformation of healthcare delivery. Technology, definitely we're focusing on, but the main focus is to change our culture, to change how we deliver care, to go to a more value-based care system than what we're doing now, which is kind of similar to our RVU system. I know people have a little bit of consternation about that, but we are moving towards a value-based system. And the reason why it's called Accelerator is because we're really moving at a pace, and Colonel Sheets can attest to it, that is not accustomed to government, right? We're moving very fast. We are moving at a pace that is honestly getting more comfortable now because we're removing barriers. We have a great team, as Colonel Sheets mentioned, that is really moving us along. So right now, our goal is to modernize the system as quickly as we can to get the 9.5 million beneficiaries the access to care that they need and to really make them the CEO of their healthcare.
I can't wait for the questions we have planned for the next 30 minutes. Hey, good afternoon, Dr. Moody. I wanted to know if you wanted to add a little color to your introduction.
I would just add, Army retired physician, had the pleasure of being the MHS CMO when the previous EHR was rolled out. Glad to see it replaced, and the emphasis now moving forward to be faster and more outcomes, and happy to be involved, continued with the service of those who serve. So thank you.
You're welcome. Thanks for joining us. And Lauren, you and I have been on the road together. We have seen some things. Do you want to introduce your where you started on the program and your new role a little bit?
Absolutely. And you didn't share our common bond as an ER nurse. We hit it off very quickly, ER nurse, ER physician, getting to work together. But no, Dr. Kosiak, thank you so much for having me. Excited to be part of the conversation. Like Colonel Sheets, I joined the program early 2019. So after IOC, before Wave Travis, and have been along for the incredible ride since then. And really just proud, as you mentioned, Naomi, just the goal now of really transforming care delivery. And I think the MHS GENESIS as that foundation and bringing us to that single integrated system is going to enable some incredible innovation. And through that innovation is going to change how care is delivered for military health systems. So very proud to have been a part of it and getting to work with this group and excited for the conversation today.
Excellent. And again, my name is Don Kosiak. I'm going to serve for the moderator for this. I'll try not to add too much color because we have such great panelists, but every once in a while I can't help add just some comments and maybe some questions to follow on that we weren't planning to do. But with that, let's get right to the agenda. The very first question is the obvious one. MHS GENESIS, we've seen in the newspaper, it seems to be rolled out, air quotes, rolled out and going. So to you, Colonel Sheets, if you look back over the last 18 to 24 months, if you could talk about the journey to get to this last few sites going live and where you feel the program is today.
That's a great question. It's funny because as you get close to the completion of a milestone, people have lots of questions. One of the questions we've received a lot is, what are you all going to do now that you're done? Reply that we're not done. We've only just begun, right? And we have the tool out there now to everybody, and it's really step one of a multi-step, transformation. And so the good thing I really focus on a lot is over the course of our implementation, we've picked up a lot of really great skills that apply to a lot of things. We faced a lot of challenge and adversity. I think when I think about our first wave was Wave Travis. It was 4 sites, 1 hospital, and some of the things we thought were problems then, now we look at day job. And the things we had to face during deployments or getting ready in the way of getting new capability ready. In the beginning, we thought we'd be able to just deploy and not insert any technology or additional capability into the baseline as we went. But we soon learned that was not going to be the case. So we learned not only to be an organization that could implement, but implement and improve at the same time and find a way to merge those baselines across the enterprise, which was really challenging. Also, forces of nature, hurricanes, snowstorms, about everything you could think of. I was somewhat, a pandemic. I was somewhat expecting locusts to appear at some deployments because I felt like we did about everything else. Military construction, sites, building things, not done building things. And once again, using all those as a platform to really do greater and better things, hone our team's ability to respond, do things, from the pandemic, we all had to change the way we did business. We continued to deploy through the pandemic. We went overseas and around the world and deployed in areas with different time zones, different address structures, and not only, from a performance perspective, overcame a lot of challenges of time and space, but also working with our industry partners who we exchange data with. It wasn't just enough for us to change our system. We passed that data to a lot of people. So making sure they could accommodate it as well was really important. So once again, I feel like a lot of the things we learned in deploying the system, MHS GENESIS, were really just foundational pieces to get our team ready to do the great things ahead.
Thanks for that. And then Dr. Moody, just as a comparison, since you've now got to watch two systems come live, what did you see different about it now being on the partnership side instead of the implementers side?
You know, I hate to date myself, but when we did the initial rollout, I was a lot younger and we couldn't spell pandemic. But in the transition that's really happened, right, it's what you know and learn, right? The good lessons learned for how to approach a wave, how to approach items systemically and systematically simultaneously really came to the fore. And a lot of the mistakes that we made the first time didn't happen. And more importantly, to go back to what Colonel Sheets said earlier, this was just the beginning, right? And that was part of what didn't happen last time around. We finished the deployment of a record. We didn't complete the achievement of goals. And clearly, DHA is committed to achieving the goals of better healthcare, more accessible healthcare for everybody, and we, the partnership, are committed.
Absolutely. Naomi or Lauren, anything to add to that first question? Because I have more for you two.
I'll just add that I'm happy to be on this side of all of that work that they did. So thank you guys so much for giving us a clean platform to start off with transformation and modernization. So great work to your entire team.
Excellent.
Yeah. And the only thing I add is perfect coming after that is, I think one of the things that Colonel Sheets won't say about herself, but the leadership throughout this, I think, is also it can't be said enough, the impact that that's had to get us to this point, to where now we can build upon this foundation. It's easy to look at this as a tech transformation, and we brought new technology, but it's such a critical change management project, and having that top-down leadership and the buy-in and the champions that we had at the top, really helping to emphasize that at each site that we went to. That buy-in is so critical, and it's what's going to enable the next phase to happen, because we got everyone to this point. So I do think it's worth a call out to Colonel Sheets and the other leaders on this team, just to get us to this point and to keep the momentum high, keep the spirits high as we went through all of those challenges that we overcame.
Yeah, I completely agree. She does not give herself enough credit privately when you talk with her and in public about the change management leadership that she had to help drive to get this to all work together. And that's the real reason we have two doctors on the panel today, because we have a dentist leader. So dentists are always smarter than doctors, so we have to outnumber them. That's the only way we can compare. So Naomi, you kind of touched on like the platforms there. We have some baseline capabilities, and Colonel Sheets talked about this is the beginning of the journey. So as you kind of look at it from your accelerator or from the innovation standpoint, what are some of the things like in the near future and maybe even long-term projection that you see coming with this new baseline that we have in place?
It's a great question. I would say with where we are now and changing the care model, we are ready to provide tools that will support this new model of care, right? So you mentioned My Military Health. That is our platform that we work with the partnership and PEO DEMS to really get us a digitized way of delivering care in this new model, right? So I'm going to emphasize the model a lot, because I really want people to understand that we can buy a bunch of technologies and we can put a bunch of systems into the environment, but if we don't change our mindset to use them, if we don't create capacity for them to be used, then we're just spent a lot of money on a system, right? So being able to look at the care model transformation and then identify tools that will support that now. We have Amwell, we have our Converge product, we have our Conversa product, and also a Server Cloud. That's just preparing us for the next set of products we can get with other entities. You might have heard or maybe seen that we partner with Defense Innovation Unit. That's allowing us to look at other companies and other perspectives on how to get after innovation, truly getting after digital front door. So the future that we see is truly a digitized, patient-centric, value-based care system that we can bring in tools to support the providers, but most importantly, to support the patients, right? Giving them that information, giving them the access to their data, so that way they technically don't need to come and get healthcare, right? They can maybe do a little bit on their own in the very beginning. We're treating more of a wellness versus a disease or a diagnosis, right? They're coming to us in a wellness perspective versus, hey, I'm sick and I'm waiting, or I had to wait because I couldn't get an appointment, and some other things you probably heard. But the future is endless. To Colonel Sheets' point, this is just the beginning. There's probably step one of infinity steps that we can actually go in this space, because the technology is going to keep changing. The way that we approach healthcare as a society is going to keep changing. And so we're just preparing ourselves. We're building another infrastructure, right, with the support of MHS GENESIS to continue to innovate and grow our military health system.
Thanks for that. Fantastic. Colonel Sheets, kind of same question. You got to take a sigh of relief. Things turned on. You paused for probably a second to celebrate with your team, but then knowing you've engaged in the next thing and the next thing. What do you see as sort of the next few months to years that are going to tie up your office, as an example?
It's a great question. Our final deployment was to Lovell Federal Healthcare Center, and that was our first fully joint deployment with the VA. And we've deployed to other joint sharing sites, but not like this. And this is the only one that's fully integrated. We learned so much from that activity, and really, I feel like left them with improvements to integration that they had not previously had. Besides sharing a common record in a common enclave, there were a lot of other focus areas that really improved how they operate there as a whole, beyond the health record. I think we're looking to take some of that as the VA deploys and go back to the sharing sites that we've already deployed to, and really optimize the experience for the patients, for our users, right? Because that's who we do this for. This, to Naomi's point, this isn't about who can put out the most technology the fastest. This is how we can best take care of our people, and those are providers, medically ready medics, and also, just really serve those who serve us. So looking to work there with the VA, our other federal partners. We brought on NOAA, came on. Coast Guard was actually, they'll tell you, the first fully deployed. We have NSA coming on. We have METCOM, reserve components out there. So a lot of other customers that we really want to make sure, as we optimize, we're optimizing for everyone. And the next phase is going to be optimization, really going back and getting it more efficient, more user-friendly, more productive. Also looking at the experience of the patients and the user, and how can we really hone this tool? How can we use and share the data? We have more data than we've ever had in things like health recommendations, population health, all kinds of things we can use this data for that we never could before, the way our systems are integrated. The power of what we have now is something we've never had. And so really just working with our partners to see how we unlock that power and potential, I think is really going to be the exciting phase of this program.
Lauren, I know you've been with the program since 2019. You were at some of those early sites going live. You got to be at some of the last sites going live. How did you feel about the journey? I know, and where you think the next opportunities are.
No, Colonel Sheets went exactly where I was going, and Naomi hit on it too. I think the exciting part to me is being along this single foundation now, and the data that we can access to make true data-driven decisions. So it's not just who's the loudest voice asking for something, or what do we think the issue is that we're trying to solve. We can really leverage the data not only to bring along innovations and help identify what's the next thing that's needed, but really to look at outcomes now and really be able to see, is the care and the protocols and the processes that we're following, are those bringing the best outcomes for our patients? And having everything in all these hospitals together on a single system is going to enable that. So that's, I think, incredibly exciting. And then the other piece that's kind of along the same vein is breaking down the silos too between federal and civilian healthcare through the interoperability and the tools that have been enabled through this transformation. I live in a big Navy town, and I've had many conversations with veterans now who say, are you the reason that when I go to the doctor's office, they can see my records? To which I say, yes, me personally, I am the only reason that's, but you get to hear these real life stories of the impact that it's making by ensuring that the person is at the center, regardless of where they're receiving that care. We're making sure that continuity stays. And I think that's just incredible. And to be able to hear that from, people it just makes it kind of hits home exactly what we're doing and why we're doing it.
Absolutely. Absolutely. And thanks for that. And I hope you ask, do you like it before you say you take credit for it? If not, you can say that was Dr. Moody that did that. That's what I do. No. So in all seriousness, so now we've got it rolled out. It's working. Now we're hearing about these new things like digital first, and General Crosland's traveling around talking about My Military Health. So maybe back up to you, Naomi, just a little bit about what does that look like? We have heard words like digital front door or digital first or My Military Health. I'm assuming it means some of the same things. Maybe you can help the audience understand sort of that vision of what's going on today.
Absolutely. So digital front door is not a new term, right? It is something that's been used out in industry. So we, in kind of, great DoD fashion, we take things and we're like, hey, we're going to call it this first and then change it to this and then change it to this. So the evolution that we have is when we first came to Colonel Sheets in the program office and we said, hey, we'd like to start this, we would embark on this new transformation within our healthcare system, and we're going to call it virtual first. And then we called it digital first. And then the contract was awarded to be digital first. And then it went into digital front door. And now it's going to be digital front door plus. So it's all the same thing. It's evolutionary, right? Because we noticed that as we started doing more discovery and recognizing more of the capacity of what we could do, and really going off of what the Defense Health Board kind of charged us to do, which is modernize, bring in technology, use your data, right? Look at your patient population, stop the leakage in purchase care, come back to the direct care system, like all those things as it evolved and as people started to understand better the full scope, digital front door plus became what it is now, right? So if you think of it, whenever you hear digital first or virtual first or digital front door or digital, it's all the same thing. It's just that it's following that wave that General Crosland first communicated back in 2023 when she rolled out her entire plan and strategy. She said we were going to go from wave 0 to wave 3, and you're just seeing the evolution of those waves happening. So digital front door is just what it is, being able to find or get your device, right? Have something on your device. I don't know if you can see it. Have something on your device, call, email, whatever you need to get that first line of communication with your provider, right? And then they have all the data to help you before you even say, like, it's like a USAA model, right? They call and they say, hi, Colonel Moody. And he can just say, you can call me Dr. Moody, you can call me Ron, but they're probably gonna still call him Colonel Moody, right? Because they have all this information right there to be able to help him. That's exactly what digital front door is supposed to do. It's supposed to give that provider all the information that they need to help you in that instance of whatever you need help with, whether it be, General Crosland's mentioned that it should be an opportunity for you to get a wellness. If you're stressed out, maybe you want to talk to someone that has financial trouble or financial support, right? It may not always be healthcare. It's you as an entire person. What is your wellness structure? And so it's going to continue to evolve, which is why it's now called Digital Front Door Plus. Whatever entity you need to get your healthcare is what we're offering.
That was fantastic. And Dr. Moody, I know that you've written a bunch about the concept of a digital first. I know from talking with you personally that it stems from your experience of working in the clinic and trying to free up clinic visits and do things a little bit differently with your patient population. Can you just talk a little bit from the clinical perspective what this initiative means on behalf of the patients that you've served in the past and that many of your colleagues in uniform are doing today?
Absolutely, and we have to be excited about this, right? I mean, if you look at what's going on in the healthcare in the United States, trying to figure out how we're going to take care of the aging population with more disease burden, where the solution for this is going to come from, it's going to be from the DHA, it's going to be from the VA, it's going to be from federal agencies doing the right thing because it's person-centered care. Now we have the opportunity not to worry about the encounter, right? We, Dr. Crosland's words, anytime, anywhere, always. That doesn't mean an encounter with a provider. That means getting the support you need and being able to do that with the most efficient resource possible, whether that's an AI answering a question responsibly, or whether that's talking to a financial counselor, as Naomi mentioned, or actually seeing someone through an asynchronous encounter or a video, or on the way to eventually, not replacing in-person care, using in-person care when that's needed. And this is what the DHA has always done, right? It's met the mission where it needs to be purposefully. And I think this is where the leadership is coming out. And again, I think this is where the opportunity for data, person-centered care, and mission to come together and fundamentally change the way we approach health and healthcare in the country.
Thanks for that, Dr. Moody. Appreciate it. Any other comments on the Digital Front Door Plus from Lauren or Colonel Sheets? Good. I know you're speechless. I can tell by looking at you. Colonel Sheets, just sort of the last. I went my friends in the Army Reserve, Army National Guard, and the Reserve Forces wouldn't let me down if I didn't let people know I'm a reserve officer as an emergency physician, and access to the system has been changing the way some of that workflow works in the Reserve Forces as well. So I want to publicly thank you for helping us get that access for those reserve forces. Anything on the horizon for the active component of the reserve as you're looking at the last little things that you want to change before we go into a full optimization period?
Yeah, I think the biggest thing on the horizon is our disconnected solution. So the component of MHS GENESIS that most people are most familiar with is what we call segment 1, the connected solution hosted out of the Enclave in Kansas City, of course. But we also have a segment 2, a disconnected solution. And the primary thought for that was in theater or other locations that may not have reliable connectivity to be able to perform care, document care, and then have that sync back to the record proper. Working with the JOMIS program office, I think we're getting ready here very shortly to go to an operational assessment with our segment 2 capability, and then onto an operational test. And it looks like the Mercy and the Comfort are going to be the first two ships to kind of be our test sites to get that done. But once again, just kind of proving that out is going to be huge to offering another type of solution to our customers who have a disconnected need. So I think that's big. I think that's going to really revolutionize what we can do with those combined options. And so really look forward to exploring that as well.
Excellent. You know, I was told that we were going to have 30 minutes to talk with this group, and we're just pushing up on that 30-minute mark. So I wanted to make sure I gave everybody a chance for some closing comments. However, I have one question left, and it may be just to follow on Colonel Sheets. Naomi, when we talk about Digital Front Door, Digital Front Door Plus, Colonel Sheets touched on it, the use cases for garrison or regular care are starting to trickle over into the operational space. Do you see some future state where that is true also with the Digital Front Door initiatives, where there may be some trickle over or dual use cases for both garrison and operational?
You know, that's a great question, and I will answer it like this. Our military hospitals are designed to train our service members to fight a war, right? What's ever happening at those military treatment facilities, making sure they have the training that they need, and then going down range is always our number one priority. So I suspect that whatever we have that comes out of Digital Front Door will be comparable or definitely supporting the operational needs, right? So I won't say it's going to be a 1-for-1, but we definitely are always thinking about how is what we're doing right now going to support our soldiers, sailor, airmen, Marines, and then Guardians downrange. General Carlson always has that. She's readiness is her mission. She's 100% wanting to have her, the service members ready to fight when they need to fight. So I suspect that that's always going to be at the forefront.
A great answer. I know you're planning to leverage the global community of your provider network to help serve. And so it's interesting to hear about some of the forethought. So with that, we're getting to the 30-minute mark, or a little over. I wanted to leave some closing comments, maybe first with you, Lauren. Anything that you wanted to leave the audience with?
No, just thank you all for a great conversation. And yeah, it's a historic moment that we're living in, going through this transformation together. And to know that this is only the beginning makes it that much more exciting. And so excited to meet again here in maybe the next couple of years and see how we can talk now about the value that's come and the transformation that's truly taken place. So very proud to have been part of this, but even more proud to see where we take it.
Excellent. Dr. Moody, final thoughts?
Final thought is I would just say kudos to the DHA, right, for what they're doing and the cultural change they're taking on, where we'll quit talking about digital, virtual, whatever it is. It's either excellent or it's not, and there's one standard of care, excellence. And the DHA clearly is leaning forward to make those things happen and discovering along the way. And I think that this is going to be transformational, not just for the DHA, but for the country as a whole.
Thanks, Dr. Moody. Naomi, any final words of wisdom to leave the audience with?
I'm not sure about wisdom, but I will say that this has been an incredibly amazing opportunity, and really, to echo what everyone else already said, this is definitely a transformation, historical transformation. And I have a little sign on my desk that I look at. My mentor, when I first got this role, sent it to me, and it says fear means two things: face everything and let me read it: forget everything and run, or face everything and rise. And I'm grateful that every day our team, we come together with the partnership with PEO DEMS, with everyone in DHA, and we face everything and we rise, because we're doing it for the people that serve us every single day. And it's an honor to be a part of this mission. So thank you for having me. Appreciate it.
Oh, you're welcome. Thanks for that comments. And Colonel Dr. Sheets, over to you for last closing comments.
Yes, thank you, Dr. Kosiak. And I think Naomi hit it on the head. None of us can do this alone, but together we can all do this, right? And I think that together, us being that team, going forward with your team is really what's gotten us here. And we all have things we bring to our team and our special skills and abilities and roles. And I think building that team is the thing that'll take us to that next phase. And once again, achieving all the things General Crossland has envisioned. I have every confidence that our team can do that. So I look forward to more partnership, more teaming, and achieving more for those who deserve it most. So I appreciate that. Thank you.
And thank you. And on behalf of the organizers, I want to thank the four panelists publicly once again for taking time out of their busy schedule to join us today to help us educate a little bit and maybe learn about what's happened and what might happen in the future. You can stay tuned for further podcasts and video casts like this. There'll be topics again specifically on digital first, some topics around cybersecurity and how we keep it all safe. We're going to talk specifically about enterprise telecritical care, and some of the DoD jointness is just a couple of the topics that you're going to see in the future. With that, we're going to sign out. You have a great day.
This concludes today's episode of the Fed to Fed Podcasts MHS Digital Front Door Series in collaboration with the Leidos Partnership for Defense Health. If you enjoyed this episode, please don't forget to visit the MHS Digital Front Door landing page at GOVTECHCONNECTS.com for the latest in MHS thought leadership. Thank you so much for joining us.